and welcome everyone to Women's Health Tech Wednesdays. My name is Nina Joshi, and with me today I have Sarah Emond. Before we jump in, wanted to give a quick background on myself. I am a consultant and a design researcher at ICER. I work in the innovation shop where I design and deploy digital health products and solutions. I am very excited about our guest today, Sarah, who is the Executive Vice President and Chief Operating Officer of the Institute for Clinical and Economic Review, or the ICER. Welcome, and thank you so much for joining us today.
Oh, it's my pleasure. Thanks for having me.
Awesome. Well, to start off, I would love if you could share with us a little bit more about yourself and your role at ICER.
Sure. Yeah, I've really been so privileged to have been with ICER now for over 11 years as its Executive Vice President and Chief Operating Officer, helping grow it from a small academic think tank into an independent nonprofit that's really focused on making sure that everyone has access to care in an affordable manner. And so we do that by using something called comparative effectiveness research to help policymakers know how much better something new that we're doing, whether it's a new drug or a new surgery or a new digital app, is at improving health and what we were already doing and what represents a fair price for that innovation. So my role is sort of on the operations side originally, everything from finance and HR and IT, all the way up through policy implementation. My background actually was in the biotech space. I was in industry for about 10 years, working in investor relations and corporate communications. And then I got my master's degree in public policy with a concentration in health policy because I really wanted to think about how policy was made. And ICER was a really great fit because evidence and data is at the core of what we do to inform policy making. And so I do a lot of work with states, the federal government, purchasers, patient groups to help them understand how ICER's work can be leveraged to get more affordable healthcare really for society at large.
Wow, that's incredible. And I think, I'm sure, you get asked this a lot, but I think especially when we think about COVID, this has just been a catalyst for so many activities and so many changes. So for ICER, how have the responsibilities and the priorities of the organization shifted kind of in not only the wake of COVID, but now kind of thinking about the long-term maybe consequences of COVID?
Great question. I think there's both an internal answer and an external answer. And given that I do operations and human resources, I'd be remiss if I didn't talk about that internal part. I mean, there was a lot we needed to do as an organization to support our staff throughout this pandemic. So in the very beginning, it was frequent communication, even if that communication was, we don't know what's happening or what we're going to do, but know that we're paying attention and we'll be in touch about how things are changing. When we first shut down the office, we thought we were going to be home for like 2 to 4 weeks, right? And so here we are 15 months later. Listening to what our team needed, our coworkers with young parents had quite an experience this last 15 months with daycare being closed and schools being closed and juggling. And so offering flexibility. So I'd say like COVID challenged us to be a very empathetic organization when it came to our coworkers. Externally, because so much of our work involves stakeholder engagement, when we do a comparative effectiveness review, it's an 8-month process and starts with engaging with the patients, with the manufacturers, with the policymakers. And we're working very closely and culminating in this important public meeting, a dialogue where everyone can talk about these really tough issues. Well, all of a sudden, we had stakeholders who were saying, we can't really pay attention to what ICER is doing right now. We have this community we need to serve, and we completely understood that. And so we actually paused all of our research for 6 months so that our stakeholders had a chance to focus on their stakeholder communities. And then when we got back to it, everything became virtual. So we had to figure out how to do these really important public conversations virtually. And I have to say, both our internal team and all of the partners and stakeholders we've worked with have been exceptional at sort of making that pivot. And then one final thing that we did was we talked about a fair price for COVID treatments. So when in the beginning of the pandemic, we were looking for something like antiretroviral or antiviral that could help, keep the hospitalizations down and improve mortality, there was a real question about what the value of that medicine would be. If you thought about it and it was going to be able to like open the economy, then the the value was infinite, right? Because we
Right.
were suffering so much loss as an economy. So then it spurred this really important conversation about who shares in the social surplus that's created by an innovation.
Mm,
Does all of it go back to the manufacturer, or is some of it shared with society? So we put out
right.
some information about fair pricing for remdesivir, which was the very first treatment approved for treating COVID.
Wow. Sounds like a lot of changes, but a lot of good changes. I really like what you were saying about how, just thinking about an organization, how COVID has really, brought space to be more empathetic and more compassionate. I think that is really important. That was a good call out. When it comes to, I kind of wanted to touch a little bit upon, I know you were talking about various stakeholders that you engage in. I know patients are a big one. What are some of the different modes in which, patient groups, can engage in ICER, not only for informing policy decisions, but really when it comes to improving outcomes in general for patients?
Absolutely. A couple of different ways. So I've mentioned that we do these really thorough research reviews over 8 months, and we start by contacting patient and patient groups with a particular condition, because we
Okay.
root all of our research questions and what we hear from them in their caregiver community. And so there's this very intense 8-month engagement that's specific to reviewing a particular new drug. The other way that we continue to build our engagement with the patient community is outside of that review. And so that's meetings
Mm,
and conversations to talk about our mission, to talk about our work. We even have a new so ICER is probably most known for putting out research that says what a fair price is for a new technology. But we really believe in a grand bargain, where if a manufacturer or another producer picks a fair price, that means that payers and other policymakers have to have policies where patients can get access. And so we have
right.
a new project called the Barriers to Fair Access project, where we're going to
Oh,
actually analyze the insurance policies of the 15 of the top formularies to see if patients are getting fair access to fairly priced drugs. So in our work with patients, and patients make up the majority of the working group for that research project, this is
mm-hmm.
something that we hope will inform their own advocacy. And as they're talking with
Yeah.
different policymakers about fair price and fair access, they'll have this compendium. Okay, ICER says a fair price is X, and ICER's also saying that, health plan, you're not doing an awesome job with making sure that people are getting access. And so we have also in the last year hired a vice president of patient engagement, which to us was a super important first time position to hold in order to build those long-term relationships with the patient community outside of a particular review. So we are constantly learning how to do better with our patient
Mhm.
engagement, because it is a journey, but we're really thrilled with the experiences that we've been having with patient groups.
That's incredible. Yeah, I think your point of transparency and access, I think, are so important when it comes to these types of decisions.
Yeah.
That's incredible. And patients are definitely a really big and important component of this. But also wanted to ask a little bit more about some of the other stakeholders that you had mentioned, like manufacturers, clinical experts, etc. What is the process that you engage with them to make these evidence-based policy decisions?
Yeah, so the manufacturers of anything that we're looking at are always invited to participate in the review. And I
Mm-hmm.
can tell you from experience how valuable that participation ends up being in terms of what the final product is. I mean, we had an experience with a manufacturer who the signal came from the CEO himself that he wanted his team to make sure we had access to all of the data that we could
Wow.
use in in our project to give the best sort of estimate of value for their new drug. And that's sort of leadership from the pharmaceutical industry we've seen from numerous companies, because they
Mm-hmm.
understand that there is a benefit to pricing in line with the value they can demonstrate through data. And so we have a very intense, I would say, process of working with the manufacturer throughout.
That's good.
Lots of opportunities for public comment. We share the draft economic model with them for feedback. We
Mm,
have several meetings with them throughout, and then they're invited to also participate in the meeting. Because it's not going to surprise you that sometimes they disagree with our conclusions, and that's okay. Having them at the table and offering their perspective is a huge advantage to getting it right. And we do talk with clinical experts because there's nuances about how a new treatment might be used or how it's going to change the
Yeah.
paradigm of care that we need to hear from those who are
Mhm.
actually doing the treatment. We hear from policymakers, whether it's a private payer or a Medicaid department, about what they might do with this brand new drug with a high price tag but high value. Okay, how are we going to make sure that we can get this to patients in an affordable manner? And so having all of those different stakeholders involved throughout the review and then really at that culminating public meeting, then we have this body of evidence that anyone can really access in order to make policy and do their own advocacy.
Mhm. I love kind of this concept of being able to co-create or kind of co-develop something kind of from the ground up with a lot of these stakeholders. And I think that could definitely, kind of have them even champion or even advocate on some level to kind of the development of these types of policies. That's incredible. And then I wanted to pivot a little bit towards the COVID article that you wrote. So you wrote an article called "Has COVID Changed Prescription Drug Pricing Forever?" Would love to kind of have you, share a few of the key takeaways that you kind of gleaned from writing this article.
Yeah, great question. It was really fun to write, and I will admit that what I did in that article was not tell you which way I think it's going, because I actually do think there's ways that the COVID pandemic has changed the way we think about drug pricing. So there has been a conversation about what is a fair price that, when we were talking about vaccines, when we were talking about remdesivir, that took a population health perspective, right? It was saying,
Mm-hmm.
okay, well, if we can reopen the economy or if we can do these things, and think about all the things that we did collectively over the last 15 months in service to population
Right.
health. We stayed home, we wore masks, we got vaccinated. This emphasis on population health was something that I found very positive that came out of COVID. And of course, there's some exceptions and some pockets of resistance, and that's going to happen. But what that helped me realize was that, so a core part of our mission is really elevating this national conversation about how we pay for healthcare with limited resources. And that conversation is easier to have when you acknowledge there are other people in the healthcare system who get harmed by high prices and unfair access. So that was one of the things I think that was positive that came about and potentially could impact how we do drug pricing in the future. More acknowledgement of the population health side. But on the other side, we had some opportunities, specifically as the US government, to have more of a role in deciding what a fair price was for something like a
Yeah.
vaccine. Because in many cases, the federal government actually supported the research and development with taxpayer money. In some cases, they guaranteed a market for a successful candidate by basically pre buying the vaccines
Yeah,
ahead
that's
of time,
great.
right? But
Mm-hmm.
what we didn't hear from either the government or from the companies themselves was a conversation about what price they should charge the US government. And so there's lots of different things that have been said. J&J was public about pricing it with a nonprofit model, but that's about as much as they've said about how they came up with their price. The many other companies said this is the value that we think this vaccine is bringing. I think there was a missed opportunity for, in the middle of a pandemic, for the government to sort of lead and say, here are the metrics we're using to decide what society should pay for these vaccines. We should
Yeah.
pay something. There's amazing innovation that is allowing us to reopen the economy, but we still left the ultimate price decision up to the manufacturers themselves. So in some ways, I think the COVID pandemic has changed a little bit about how we think about drug pricing and the conversations that we need to have. And in other ways, the status quo remained, and the manufacturers were able to sort of pick the price because they're the ones with the monopoly pricing power. I think where we go from here is, do we have lessons that we can draw either from what happens when there's significant government investment in development? Does that change the conversation about what a fair price is at the other end? Or continuing to have this acknowledgement that drug pricing is a population health concern and that we need to
Yeah.
be thinking about it from a population health so that we don't forget the unseen people in our healthcare system who are harmed by high prices.
Mm-hmm. Wow. Absolutely. And I'm so curious, kind of just because you are, completely immersed in this space, you brought up something really interesting about, how collectively we all kind of leaned in and really kind of took this public health and population health lens when it came to COVID and, the vaccine, medications, all of that. Just based off of what you're seeing right now, do you ever think that that type of model could ever be replicated again, or do you think it was just purely circumstantial and the jury's still out on whether or not this is kind of an approach we could take in the future?
I do think we can take this approach in the future because we have seen the willingness for sort of collective self-sacrifice in order to sort of
Mm-hmm.
help. What I think will be really interesting moving forward on that is thinking about the areas in health that have not been well studied and where we have a huge unmet need, right? So think about the issue of antibiotic resistance, right? The entire point of
Yeah.
developing antibiotics is actually so they don't get used that much because you don't want to be to develop resistance to them. And so
Yeah.
if I'm a for-profit company, what motive do I have to invest a lot of investor money into a new antibiotic? So is there anything from how the government de-risked and incentivized innovation
Mm,
for developing vaccines that we could apply to something like antibiotic development? The other thing that this
yeah.
pandemic showed us is we had the opportunity to do a lot of preparation for the situation we were in. There were a lot
Mhm.
of people saying this was going to happen, not if, it was when, and there were things that we could have done. Now, I think that the fact that we got vaccines approved in less than a year shows that we have an amazing infrastructure to be able to pivot and to answer a tough question technically very, very quickly. But what can we do to incentivize the development of additional vaccines for the next pandemic? And that could just be platform investment, right? So
Yeah.
if we think
Totally.
mRNA is going to be the way we're going to hit every future pandemic, how do we have a manufacturing infrastructure and a research infrastructure that's
Mm,
quickly able to pivot? And how do we invest in that? Is it private investment? Is it government? So I do think that there
mm,
are some positives that have come from that sort of collective self-sacrifice that help us know that there are ways to incentivize some of this unmet need that we have in
yeah.
antibiotics and antiretrovirals that the lessons from COVID could inform.
Absolutely. And kind of speaking on the sense of innovation and really, how things have changed or really how disruptive it could be. Really kind of thinking more along the lines of technology. How do you think that technology can really improve access, fair pricing and delivery of these quality healthcare solutions? I think, at large for society, but also kind of thinking about it when it comes to women's health specifically.
Yeah, I think there's a lot of opportunity here. And what's interesting is I don't think we fully know exactly how much we can get from leveraging
Yeah.
technology. I think we're still so early in doing it. And some of why we don't know is because there's still real disparities of access to technology, right? We don't have broad
Mm-hmm.
access to broadband. We don't have,
Yeah.
all of these other things that we need as an infrastructure in order for whether it's digital applications, digital health, and telemedicine to be really changing the way we do things. But I do think that we have learned with telehealth that it's a thing and it's
Mm-hmm.
fine for most cases, right? And we can develop ways to be able to reach people without having to send them into the doctor's office. I will say, I think there's a lot that needs to be done on the reimbursement side to make sure that we're still providing adequate reimbursement back to providers in order to provide the service which patients really want. I think that there's a lot in the digital health space that can actually, as much as I just said, there's some disparities there, eliminate disparities. We know with a
Mm,
lot of behavioral health, there's a significant amount of stigma attached. And we also know that having technology platforms in order to do with counseling visits or cognitive behavioral therapy, instead of going into a therapist's office or going to a group therapy session, has real benefit for patients with certain conditions. And I think that that can level the playing field. I think when it comes to the women's health piece, I think that what I'm most excited about is is the innovation that we might actually see in the caregiving space. So we know that
Mm.
overwhelmingly caregivers in this country are female. And we also know, and we have tons of data about the physical and mental health impacts, the financial impacts, the work productivity that's impacted, and it's significantly falls on women's shoulders. I'm thinking about what technology can do to ease that burden. This is a little bit
Yeah.
more like Star Trek in the future, but I mean, if we had monitoring systems, if we had some of these things that could at least take some of that anxiety away from a caregiver running out to the food store for 15 minutes and,
Yeah.
leaving an aging parent at home, but knowing they'll be safe. I'm super excited about what technology is going to do for that. I'll share this one quick anecdote. I had this conversation with my dad the other day. My dad's in his 60s. He's very healthy. He's doing great. And he was talking about, like, when is the time going to be when he can't like drive his car anymore and what a burden that's going to be for his children. And my brothers and I
Mm.
looked at him and it was like, Dad, before long, there's going to be self-driving cars. You're going to be able to go wherever you want. And I thought to myself, as the future potential caregiver, what a relief that's going to be, as I've watched my friends sort of coordinate an army of siblings taking their dad to doctor's appointments because he
Yeah.
can't drive anymore. And so anyway, it's probably a silly example, but I was thinking about how, especially on the caregiver side, which so
Yeah.
disproportionately impacts women, I think technology has a lot of opportunity.
No, I think that's such a great example, especially because we definitely see that transportation really is a barrier when it comes to healthcare access. And so, the fact that there is being this migration almost towards more digital solutions, I think can really help eliminate, that gap that a lot of people have when it comes to just accessing healthcare. But yeah, I definitely love the approach of really, having telehealth kind of answer the call when it does come to caregiver burden, because that is a really, really big issue.
Absolutely.
And kind of speaking about technology a little bit, because I know, there is a lot of conversation about how pharmacy is kind of like the next digital health disruptor, with like the direct to consumer generic prescriptions, kind of all of that to help improve access. Would love to kind of learn, your take on it and kind of what you've experienced when it comes to that type of a model.
It's been really interesting because Amazon has been sort of dabbling in this. They bought
Right.
PillPack and they've been sort of registering as pharmacists in some states. And I think there's a possibility they're going to introduce a big disruption, right? They've done that for so many other things. I also think that it's really interesting that that big disruption hasn't happened yet. Right. So this
Yeah.
is hard and this is complicated. The supply chain for delivering medicines to individual people, whether through mail or going to pick it up at your local pharmacy, is complicated. And there's a lot
Mhm.
of people who are involved who want the status quo to stay exactly as it is because their entire business model is built on the status quo staying exactly
Mhm.
as it is. Whether you're the wholesaler, the manufacturer, the specialty
Yep.
pharmacy, the retail pharmacy, the PBM, I could go on and on. And
Mhm.
so I'm a little bit skeptical that we're going to have this huge change overnight when it comes to
Yeah.
the delivery and the access issue. I think it will come. And I honestly think it's going to come when the generation sort of behind me who technology isn't even a question, right? It's just
Yeah.
omnipresent, right? And
Yep.
so they're going to demand that change. Whereas I think my generation or the ones above us haven't been demanding it because we sort of grew up with of course, you go to the pharmacy to pick up your
Mm.
medicine. That's where you go to do that. So I think it
Yeah.
will happen, but I think we're a few years before we get that big, disruption. I could be wrong. Amazon has proved us all wrong before, and so it's possible that we're having that disruption maybe a little sooner.
Hmm. Yeah, it's really interesting that you kind of bring that up, because there's definitely a lot of, ad hoc types of solutions, but really having an entire system in place that kind of thinks about it as a paradigm will be a little bit, it's just a lot more complex.
Yeah, I think it's one of the things that I found most interesting. So my background was in, pharmaceutical industry. I had great understanding of the FDA process and all of that stuff. Reimbursement
Hmm.
process I knew a little bit about. But when we started at ICER about 6 years ago, really focusing a lot of our work on prescription drugs, I remember just being shocked at some of the things that were like built into the system that everyone sort of accepted as normal. So I'll give you
Yeah.
this quick example because I find this interesting. Some drugs are reimbursed on an average sales price basis. These are drugs that physicians administer in a hospital or in a clinic. They buy the drugs and then Medicare gives them a reimbursed price based on average sales price. And then they also give them a particular percentage bump as like an administrative fee, but the percentage is based on the average sales price. So there's technically, if you had two drugs that work exactly the same and one costs $5,000 more, there's an incentive for that doctor's office to pick the more expensive drug because
Wow.
you'd get a higher administrative fee. Someone told me this and I looked around and I was like, that can't be true. Like,
Wow.
what did we think was going to happen when we set up
Yeah.
that policy? But there are entire systems and most doing really good work, and they've built their entire business model on these administrative fees in order to provide the care that the patients need, whether it's an oncology center or otherwise. So any conversation about changing that is really hard because you're talking about changing the revenue basis for a business model that they've been working at for years. And so there's a lot of that in the
Mm.
pharmaceutical supply chain.
Hmm. I did not know that. I didn't know that was the case. That is crazy to me. Wow.
There's a
And
few more, but I'll spare you.
wow, you've seen it all, huh? Just with everything that you are, your background and kind of where you are right now.
It's been a journey and I love it. And I learn something new every day too. And so
Hmm.
every day we're finding out some other sort of nuance to the system that needs attention or some unintended consequence to a policy decision that was made in
Yeah.
good faith that's not getting us the healthcare system that we all want. So, yes.
Hmm. Absolutely. And then kind of, last thing I really wanted to ask you was what are some of, the projects that you are all working on right now? What's kind of in the pipeline, whether that is specific medications or digital health solutions that you're looking into. We'd kind of love to learn, what's coming up next.
Yeah, so our next big meeting is actually on Alzheimer's disease. And
Wow.
this one, there is a new treatment being evaluated by the FDA. We're going to hear from the FDA about whether or not it's approved in the next couple of weeks. And frankly, there's been a really important conversation about the evidence of whether or not the drug actually helps patients with Alzheimer's disease. And so then that begs the question of then what's a fair price for a drug that, we might not have enough evidence to tell whether or not it works. What I have been most gratified by watching this project come through is the way that we've been able to work with the caregiver community on this, because it's impossible to have a
Mhm.
conversation about what's the value of an Alzheimer's treatment if we're not talking about the caregiver impact. And so the
Yeah.
National Alliance for Caregivers, Us Against Alzheimer's, several different organizations have been engaged in their review, giving us really important feedback so that we can reflect that in what we do. And again, as we talked about earlier, we know that the majority of caregivers are women. And so this is, something that's really important. We've also done over the years, some reports that for conditions that disproportionately impact women and some entirely for women, we've done reviews of ovarian cancer and endometriosis,
Mhm.
hearing directly from migraine, which, majority of people who suffer from migraine are female. We heard
Mhm.
from women a lot about, and we were able to elevate the voices of a healthcare system that wasn't always designed to take them seriously, wasn't always
Yeah.
designed to think about their pain and their desires for particular outcomes seriously. And we were able to elevate that voice through that work. And so we've got a pipeline. Our website, ICER.org, can tell you all of the things that we've announced, but myasthenia gravis, Alzheimer's, we've got a couple of reviews coming up that people can keep an eye on and see how they go.
That's incredible. Yeah, definitely excited to kind of see how this all kind of keeps going. I think it's such an important conversation, and really great that you and your team are continuing to advocate for this really necessary change. So thank you so much, Sarah, for being here today. We have some upcoming events coming up, so definitely be sure to check out our next guest for the Women's Health Tech series. And then once again, Sarah, just really, really wanted to thank you for being a part of the discussion. It was incredible. Learned so much myself.
It was really my pleasure. Thank you so much for having me.
Wonderful. All right. Well, thank you so much. Have a good day, everyone.